And with that, thank you so much for coming, everyone, to our inaugural Columbia and Michigan Interprofessional Education joint event focused around oral health, the mouth-body connection. So in these next 30 minutes, we're going to go through a series of slides that help everyone, whether you're a dentist or in other professions, to help see like things that dentists will see, and we'll get an opportunity to speak with one another as we continue going on. So as we begin, we're going to start with a little bit of speed networking. So it's only going to be 30 seconds per person. So just as you enter your breakout rooms, talk to one another, see what their name is, what school they're from, and if you can have any job outside of what you're working towards now, what would it be and why? And I will open. Oh, sorry, Michigan people are on a wrong Zoom link, so we will wait momentarily.
Also, will you remind the Michigan?
Okay, yay. Welcome back, everyone. I hope you had at least somewhat of an opportunity to meet someone from a different school. And if you don't worry, there will be opportunities later. And just another reminder, if you are just joining now, make sure on your name it says both your program, whether it's Columbia or Michigan or any other place, and also what profession you're enrolled in right now. So with that, we will continue on. So just a brief introduction for our Columbia IPE Student Advisory Board. Our mission statement is to just promote IPE across this whole campus, and we represent all 10 programs that we have on campus. It's medical, dental, PT, OT, nursing, public health, nutrition, social work, genetic counseling, and pastoral care. So these are some of the events that we've done in the past. We always have a super fun time, and everyone is basically encouraged to just make sure that they've left every event meeting someone new and also learning something about someone else's profession. So our IPE Advisory Committee this year is this fabulous team of females right here. And with that, I will pass it over to Tommy.
Thank you, Michelle, and welcome everybody. My name is Tommy. I'm one of the co-chairs from the SAC Student Advisory Committee from the Michigan side. And what SAC does, or SAC, is we serve as a liaison between the Executive Committee of Center of IPE at Michigan with our student different schools and also student org leaders. So if you go to the next slide, you can see that there's a map of how our structure works. So we represent different students across our 3 campuses, ranging from public health all the way to occupational therapy, and then also our 6 student orgs for this year. And we have our 3 co-chairs. We each oversee different territories such as curriculum, collaboration, and overall our executive chair, Nikki. And with that, I have a survey for you guys to fill out. It's a pre-survey before the presentation. You can just kind of like fill out as we get started because we don't have a ton of time, but that way we can get some information about your engagement before and afterwards. So while you guys are clicking the link in the chat, I am gonna start slowly.
It says I don't have permission to take the survey. It seems like I'm not the only one with that problem in the chat.
I think it might be restricted to Michigan only. Let me adjust it.
Thank you, Nikki. And thanks for pointing that out. I will slowly get started. Hopefully you can multitask. So oral health, or, dentists, we're the profession of oral health, and we take care of, a lot beyond just teeth, and it might not seem like that in the surface. So today, our overall objective is so that all of us get a better understanding of what our practice scope covers, so you can get a better understanding of how we can help your clients, your patients, as you move forward in your career. And to start off, we're going to go through 3 terminologies. Caries, it's like cavities, usually due to a bacteria called Streptococcus mutans. It produces acid and destroys the surface or enamel of the tooth and then into the underlying layer. Pathology, as dentists, we do oral health examination. We check both extraorally, which means like the head and neck area, and also like some muscles and lymph nodes. And also we check intraorally on your tongue, on your gum, on your teeth to quickly screen for oral cancer and decays. And lastly, periodontitis. It's a disease, inflammation of gums, and I'll talk about it later too.
So going into that first topic, caries, AKA cavities, AKA tooth decay. What's really interesting about cavities, and this is something that I did not know before starting dental school, is that it's transmissible. So we had this one professor, and anyone from Columbia, I know you're like laughing right now, because she called caries the kissing disease. And she was saying, if moms just didn't kiss their babies, we would never have tooth decay. And while that is somewhat true, the point still stands is that it is transmissible because as this bacteria that Tommy mentioned, Streptococcus mutans, basically this bacteria colonizes the teeth, and basically any type of sugar or carbohydrates that you're eating and is sitting in your mouth, this bacteria is able to use that as its own food, which in turn demineralizes the teeth and causes this tooth decay. So caries and cavities has really been influenced by our public health efforts. So we want to thank everyone who is our public health friend on this call. So water fluoridation was a huge, huge success for public health and also dental health. And public health efforts have really helped reduce caries with fluoridated water. Most of us all live in fluoridated water areas. Also nutritional guidance and oral health instruction. And also something that's interesting to note about cavities is that a lot of medications that your patients will be taking are hyposalivary, which means that they reduce the amount of saliva flow that a patient is able to make. And in turn, it keeps the mouth at a very, very dry level called xerostomia. And it can have all these adverse reactions and basically just make it a much better environment for these bacteria to continue to replicate.
Periodontitis, which is something that I mentioned earlier, it's again inflammation of gums, but beyond just inflammation, it's actually a worsened stage of a periodontitis or gingivitis, which is just an inflammation. For periodontitis, there's a irreversible loss in bones around the teeth. So you don't want to get disappointed. A lot of us probably has a little inflammation from gingivitis, but periodontitis is irreversible. Again, the etiology or the source is from the same bacteria. There are more bacteria beyond the one that we just mentioned, and risk factors include smoking, genetics, and diabetes.
And sorry if these photos like gross anyone out. We tried to like get good photos, but I know that not everyone loves teeth as much as we do. So that was a good warning going into the pathology slide. But a lot of pathology, both of systemic diseases and also diseases that occur in the mouth, their first way that they are diagnosed are in the oral cavity. So for example, oral cancer, as it is aptly named, it's very common on the lateral border of the tongue, which is the side border, and the floor of the mouth, which is under your tongue. And it can be caused by a myriad of things, including, as it says here, smoking, alcohol, and HPV 16 and 18 specifically. And then these photos at the bottom are manifestations of just systemic diseases. And that is often why your dentist is the first person to be able to diagnose overlying issues. Oh, Crohn's, have you seen a nutritionist lately? Something like that. So that's why a lot of dental health ties into systemic health, because we often are the first person to see it. A lot of patients see their dentist twice a year and don't see their primary care physician that often, or if at all. So we're a great first step of referral to go on to a more serious disease.
Now we're going to talk about how oral health connects to other common disease that you've heard of that is related to our systemic health.
So early childhood caries, AKA ECC. What everyone should know, whether you have a child or you're planning on having a child or you work with children, children should see the dentist by either the first year or the first tooth. And the reason for this is because a lot of parents, especially new parents, don't really know how to raise their children. When do I see the dentist? They're all baby teeth, they'll fall out anyways. And while that is true to some extent, it's not really true in the sense that you're setting nutritional guidelines going forward. So something that's very important is that you should never put a baby to bed with their bottle. That is also why ECC is often called baby bottle caries, because milk and juices, they're very, very sugary. So as the baby falls asleep with the bottle, they have that sugar on their teeth all night long, and it can cause a lot of cavities in kids. And it's very sad when you see a very young child with every tooth needing a filling, because the kids don't want to go through that either. So it's very important to limit the at-will bottle feeding and also breastfeeding, and to start brushing habits early.
Now on to something maybe we could relate to adults. So periodontitis or gum health, periodontal health has a direct correlation, a bidirectional effect with diabetes. There are a lot of words on the slide simply to say, if you have gum disease, your diabetes will be worse. And if your diabetes will make your gum disease worse. It's kind of like a cycle that you can see in the diagram at the bottom. So what is really important is that we take care of our periodontal or gum health so that we can control our diabetes better, and or in reverse, if we control diabetes better, we can take better care of our gum. And excuse me, and there are other dental complications that are related to diabetes, such as dry mouth, which we talked about briefly, caries, the cavities, candidiasis, which is something that you can see on the graphic one in the middle. It's kind of gross, but it's a fungal infection, and then also it's harder for you to heal your wound.
So also atherosclerosis, which is basically when you have a bunch of plaque buildup in your arteries. And this is what we know causes heart attacks and other things like that, and having bad cardio health. So this gum disease also accelerates this plaque buildup. And without getting into a lot of biochemistry, basically a lot of inflammatory mediators are present both in the oral cavity and in your heart. So this statistic down here, I think, is very interesting. 91% of patients with heart disease have periodontitis, as opposed to 61% of people without heart disease having it. So that's just another significant way that we see that the oral health is connected to our overall body systemic health.
Malnutrition, if you don't have teeth, it's hard for you to eat. That's pretty easy to understand. So, keeping your health, and especially your oral health, is super important so that you can keep eating. There are issues with elderlies with their dentures. If they don't fit well, dentures could cause irritations, could cause lesions, cysts in your mouth, and also just difficult to restore the full function even with a denture, because the way that you chew, it's not going to be the same as having natural teeth.
And this is something that is not usually on the forefront of people's thoughts, but anyone who has any type of special needs or arthritis, which kind of leads into our PT and OT colleagues over here, the manual dexterity of a toothbrush is not the easiest to use. I mean, think of your toothbrush. It's very, very skinny. You have to grip it. You have to be able to turn the bristles in such a way. So for example, one of my older brothers is special needs, and he is unable to wrap his hand around a toothbrush. But this toothbrush that's number one, or the toothbrush with a tennis ball, he is able to grab much more easily because his manual dexterity can grab that. So this is something that we also need to take into effect, and that's why working in an interprofessional team is so important, that when we can work with our OT colleagues who say, this person doesn't necessarily have the best range of motion, they need more manual dexterity to be able to hold their toothbrush. This is when we can come up with ingenious solutions and make sure that everyone is able to care for their oral health, and also just make sure that people are able to feel comfortable in how they are treating their own oral cavity.
Another fun fact for their OT students, dentists often have to work closely with the patient, and then it's really hard to see in a small oral cavity. And research shows that there are 87% of dentists suffering from chronic pain just from the ergonomics from our work.
And going into a slightly more serious topic, but abuse. Dentists are mandated reporters by law. And so what that means is that you are required to report all cases of suspected abuse or neglect. And this also means kind of sussing out what the situation is. So if you have someone who's saying, oh, the kid fell down the stairs, but the teeth are flaring out instead of in, you kind of are reasoning, if he fell down the stairs, the teeth would be in, and just kind of recognizing the signs for that. So some of the signs are listed here: burns of the tongue, if it's forced feeding, any fractured teeth, jaw fractures, bite marks, bruising, and just it's really important to understand the role as being a mandated reporter to help any children who is in this situation and make sure that they're getting the best care that they possibly can and removing them from that unsafe home.
Eating disorders. Dennis can see characteristics of teeth that displays eating disorder from the habits of throwing up. So you can see that in the picture on the top. When you throw up, your vomit is acidic, and that can cause erosion on your teeth from the back side, or we call lingual side. So because it's coming from your throat. So if you see that pattern on that side, then we kind of it's this first signal to us that it's the eating disorder. On the other hand, if you're ones who loves to drink pop, you will get the erosion on the front side of your teeth, because that's where your soft drinks and your teeth make contact there. So again, acid erodes teeth, and then it's not a good thing to for the oral health.
And pregnancy. So this is something a lot of my patients come in while pregnant and they're saying, you know, my gums are bleeding so much more. I feel like my gums are just like fatter than they used to be. And it is not in your head. This is actually a studied phenomenon, but periodontitis, aka the gum disease, during pregnancy increases just in general in a lot of people. And whether it's due to fluctuating hormone changes, it's not entirely well known within the scientific community. So it is definitely an area that we can have more research. But the fact of the matter is, as this photo shows, a lot of the times people's gums just like really grow over their teeth while they're pregnant. And the downside to that, other than the poor aesthetics, is that you have an increased risk of having a preterm labor. So that is this statistic over here, which is harrowing, that the preterm labor is 7 times more likely in mothers to be that have periodontal disease than women with healthy gums. So going into very briefly what is safe and not safe while you're pregnant to check up at the dentist, you can and should get a cleaning at any trimester, but they do recommend that you avoid elective treatment, to not get any x-rays, to have the fetus have any unnecessary radiographs, and any types of drugs that you would be taking. And if you necessarily do need to do it, just not during the first trimester.
Sleep apnea, it's a disease diagnosed by physicians. It's the most common non-infection disease in the US that's often undiagnosed, and dentists also screen for that. So essentially this disease is your, for example, tongue or your tonsils blocking the airway. So patients will experience some unnatural behavior during sleeping, such as like stop breathing or snoring really loudly. Those are some first symptoms. Like I mentioned earlier, it's often undiagnosed, but dentists work in oral cavity has regular convenience access or screening for the patient. So that's what dentists can do as far as screening and referring that to a physician for confirming diagnosis. But what we can do, orthodontists can fabricate a appliance to help with that. There could be a jaw surgery done overall to improve quality of life, as those patients that are experiencing this disease will often be fatigue during the day due to sleepiness.
And so finally, just the barriers to care. So a recent survey that went out, I believe in 2018, asked a sample of United States adults, what stops you from going to the dentist? And as you can see, the overwhelming answer here was cost. And there are a lot of secondary, tertiary, quaternary answers as well, namely fear, inconvenient, not finding a dentist, not thinking they need it, but cost is truly the number one. And other barriers to care can include a language barrier. I mean, at Columbia, most of the patients that we see are coming from a Spanish speaking background. So making sure that you are able to communicate with your patients, things like that, they can all contribute to people not seeking dental care. But going back off of cost, this is a graph from 2016 about the uninsured rates of dental coverage. And as you can see, children ages 2 to 18 have the lowest uninsured rate, which is wonderful because a lot of states, as like the state of New York, cover dental care for children up to the age of 18. So as you can see, the graph seems to be trending downward. We hope that over time it's still trending downward. There was a big bill that is coming in front of the House and the Senate, basically the Medicare Part B, which is turning into the Medicare Part T, and this is not an insurance cost right now, but just basically making sure that we have care for those in our population who need it the most and who aren't seeking it because of the cost of care.
So overall, take care of your teeth and they'll take care of you. And we're gonna go to the next slide to see some of the things to be mindful. Because Valentine's Day is coming up, please make sure you brush your teeth twice a day, 2 minutes. The way that I remember is like 2. Floss once per day. I did not understand the importance of flossing in a dental school, but when you floss, trying to put it down and then make a U shape, like hugging around the tooth that goes down into your gum pocket. And then when you pull up the plaque that comes with that, it just amazes you every time. So try that out. And once you do that, you'll kind of see the gums are less inflamed. You might bleed at first a little bit just because, when you first do it, but then overall the inflammation will decrease as you floss more regularly. Brush gently, don't brush too hard because that can also cause like a little cavity in your mouth or on your teeth surface just from like the hard brushing. And make sure you visit your dentist regularly so you can get the treatment that you need.
So, oh no. Okay, so sorry, I'm obsessed with Kahoot. So right before we break into breakout rooms, with our few moments that we have left, we are going to switch to a Kahoot. So if everyone can join. Can everyone see my new screen that says the Kahoot on it?
Yes.
Okay, perfect. Thank you. There may or may not be prizes for the winners.
Oh, I missed the music.
Oh, I'm so sorry. I muted that.
Oh, nice.
Okay, I'll give it like 10 more seconds since it seems like mostly everyone is in. So join now or forever hold your peace. 5 more seconds. Okay, we're gonna start. It's only 5 questions and they're really fast, so. What bacteria is mainly responsible for caries? Strep mutans. Nice. Yes, they're really fast. They're really fast.
Love the music.
Kelsey.
Nice, Kelsey.
Yeah, all right. Why do some medications cause adverse effects in the mouth? Yes, they lower the amount of saliva, and saliva is protective against cavities. Ah, AJ took the
lead.
Oh, let's go.
Which is a description of the effect bulimia can have on the teeth. Nice, we're almost 100% on these. Yes, erosion. So that is one of the telltale signs for dentists. All right, Kelsey and AJ up there. When should children first see a dentist? like Bryce, you're at first too. Oh, neck and neck. All right, last question. Which is not a barrier to care? Yes, all of the above. Jonathan, if you want to just put your email in the chat, we'll make sure you get a prize. And our first place, congratulations, Kelsey, AJ, and Jonathan, and also Shreya and Jen. If the 5 of you want to just like put your email in the chat, we'll make sure that you get a nice little gift. Small. And with that, we are going to go into the very final portion of our event tonight. So we are going to open breakout rooms. We're going to recreate them. So I hope you'll get to speak with someone who might not have gotten to speak with before. And if you want to take a screenshot, basically the group that we open will be the one that you'll talk about. So just briefly discuss, it'll only be about 3 minutes, how you would manage this patient, how you would manage them interprofessionally, and make sure that they are getting treated with the utmost quality of care. So with that, I will open the rooms. Okay, I think most everyone is back now. So we're just gonna run through under 1 minute. You're almost out. Basically how we would all just work together on some of these cases.
Group 1, pediatric consult, nutrition, social work, public health. Anything else you guys want to add for the 4-year-old with caries? Yes, no, yes. Next slide.
Diabetes. Now, this is something that affects all of us, but specifically having a nutritional intervention and also a medical intervention can help the dentist make sure that they know the HbA1c level of the patients that they're treating and make sure that they're getting the proper care.
Group 3, atherosclerosis, interprofessional collaboration will be nutritional and medical intervention. Anything from group 3?
Malnutrition, I think, is a big one that affects so many of us, both our nutritional and medical, PT, nursing, public health, and social work colleagues, in addition to all of us in a sense, and just making sure that everyone is able to have the nutrition that they need and live a safe life.
Special needs, like the example that Michelle talked about, using a customized toothbrush for better grip. So that's physical therapy, OT, social work, nursing. Anything else from group 5? All right, next.
Abuse. Now, this is something that's very, very difficult and especially very important for mandated reporters to take that job seriously if they do suspect something, and intervening with social work, public health, and their primary care physician.
Eating disorder. Anything from group 7 to add?
It's not really something to add, but this is a question like, should we, as dentists, should we do the dental work first, then refer to psychiatrist, or should we do the psychiatry work first, then the dental work? Because it could damage. We could do restoration, but then the disorder can cause more damage and basically ruin the work. And I don't think that's necessarily advantageous to the patients.
That's a great point, and I'm going to attempt to answer, and Michelle, please fill in anything that you want to add. I think that best approach for all patients is to listen to their main concerns as they come in and then evaluate what their most urgent, not necessarily what they think is the most urgent, we have to take that into account, but like most urgent care to make sure they are like, stable and healthy to the point where they can move on to some other like treatment that can wait a little bit. Michelle?
Yeah, I definitely agree with that. And especially with something as like cautious as an eating disorder, a lot of people who have eating disorders don't know that they have eating disorders. So that's a conversation that you definitely want to approach very delicately and not just outright say, I'm not going to treat you until you get this fixed. So at Columbia, if this is something that we suspect, we'll first kind of, make our diagnosis, maybe bring in our faculty with our diagnosis, and then try to approach the patient about it. And based upon how they answer, get a social worker involved. And social work is definitely very, very prepared and handled to have these conversations. And then in terms of your question about treatment planning, making sure that any urgent care needs are treated first. So if this patient has a rotting tooth that is causing bacteremia and their face is swollen this big, that's obviously something that we're going to have to treat before that they have any other disorder treated first. But it's definitely an interprofessional approach to care. And it's a great example of something that we deal with a lot more than you would want to. And that's something that we love to collaborate with our other colleagues on. I hope that answers the question.
Yep, thank you.
Okay. Pregnancy, as we spoke about, just making sure you know how to be safe. Any gingivitis that's a cause of hormones is very normal. And before doing any dental care that's not specifically routine, having that medical intervention, and also making sure that you're getting the proper nutrients that you would need during this time.
Sleep apnea, like I mentioned earlier, dentists do the screening and then refer to physicians if they suspect high risk or the disease itself.
And access to care. So this is something that we're all in it together. Clearly, all of these cases that we propose tonight are something that every single person from every health profession can find a way to relate to. And we hope that you came across from this event afterwards with a little better idea of how dental health can affect systemic health and vice versa. So that being said, any further opportunities as we wrap up tonight? For Columbia kids, if you would like to join our listserv to stay in the know about other IPE events, you can email us, columbiaipesab@gmail.com. We'll add you to our listserv and give us a follow on Instagram, and we'll make sure we post everything there. And Michigan?
Yes, we are having our meeting right after this, so just stay right here and we will continue with our Michigan only meeting.
Yeah, so with that, thank you so much everyone for joining tonight. We hope you learned something. Please fill out the surveys that were sent in the chat just to help us improve our upcoming events. And with that, Columbia people can jump off this call because I think Michigan is going to use it for their meeting. So thank you all for joining tonight. We'll see you at the next one.